Good morning, everybody. Welcome to the Social Media Corner. I'm here with the star of this morning live surgery, Sofia Aroca. Good morning, Sofia. Welcome to the Social Media Corner.
Bruno.
Sofia, can you summarize a little bit the surgery of this live surgery of this morning?
But the procedure was implant placement on the side of 1-1 tooth, and also reconstruction of the neighboring teeth who were periodontally compromised before, and but the patient at this time was periodontally healthy. Therefore, it was an implant placement with periodontal tissue reconstruction.
Very nice. And this was your first live surgery at the EuroPerio. What exactly this represents for you?
But you can imagine that from the time that I knew that I was chosen for that, I was extremely proud and, of course, under stress all the time, because I know that how important it is for all of us, this event, and to have the opportunity to share this clinical knowledge is, for me, is a wonderful gift. Yeah.
That's wonderful. It was a very delightful and amazing surgery. And Sofia, can you describe a little bit the technique that you use for this specific case, and what was the reason to choose this specific technique?
The reason was, first of all, because we had clinical attachment loss on the neighboring teeth, and also recession defects, and I wanted to fix these two problems: implant placement with the reconstruction of the periodontal tissues in the neighboring teeth. And not really because I want to improve, of course, the aesthetic. Of course, the aesthetic will be improved.
Of course.
But it was the most important thing was to rehabilitate the patient, because she really, one of the demands is to have an implant. And also to treat the periodontal problems around. That's why, and we were, of course, I was discussing with my team and people that I know what can be the best procedure, and we were checking all the procedure when we were planning. And the best procedure, I think, is what we did.
Perform. Yeah. And of course, the complexity of the case increases since it's an aesthetic case.
Exactly,
right?
exactly.
So, and we were dealing with a stabilized periodontal patient or a periodontal compromised patient. Does this procedure becomes less predictable because of that, or not at all?
Not at all, because the patient is from a healthy, she's healthy from a periodontal. Exactly. She's healthy and she's really compliant. What is the most important thing? Because the patient is healthy from a periodontal standpoint, but is not really compliant, you cannot go for this kind of procedure with her.
It's not predictable anymore. And tell me, how important is the planning in these cases?
Is paramount importance.
Of course.
You cannot improvise anything, and I think it took me first of all to choose the flap design, and after in the programmation at least more than 3 months.
Yes, and of course you're a periodontist, but the planning is also important from an implant, but also prosthetically, right?
Yeah, exactly.
Indeed.
Exactly.
And Sofia, how important for you is the, for example, the suture technique in this case? Because Christelle was mentioning in the end of the surgeries, we are quite tired.
Yeah.
And this is the technique that we need to pay a lot of attention. So how important is the suture technique in this case?
I think every step of the surgery is important.
Of course,
but the suture is really
crucial.
Crucial.
Yes.
Crucial, and also in the way you do, because that's why I choose to go apical-coronal direction, and the way I was closing the vertical releasing incision, in order to reduce the tension at the marginal level.
Absolutely.
At the marginal level, and when you go there, you arrive to the marginal level to take the suture in just position and not to feel any tension. Yes, thanks to the closure of the vertical in this way. And is extremely important,
And how much time are you going to wait until load that implant using this specific technique?
How long? I think between 3 and 6 months.
6 months?
Yeah,
Okay.
yeah.
Sofia, thank you so much for being here. I know
Thank
that you
you, Bruno.
celebrate your birthday a few days ago,
yeah,
right?
2 days
so
ago.
happy birthday.
Thank you very much.
And thank you so much for this amazing surgery. It was really a pleasure.
Thank you.
So
It's
guys,
a
this
pleasure
was
for me.
Sofia Aroca telling us some of the insights of this live surgery. Stay tuned.